leaders within provider-facing facilities or health plans just from that clinical side. And today we're seeing a lot more of physician leaders, chief medical officers, even other clinician leaders who are bringing that chief clinical officer or chief medical officer title more than just the clinical aspect, bringing their comprehensive understanding about what the healthcare system is today. And a big part of that is technology. And so how do we take these tools, these services, these technologies, AI, and how do we bring that together to create a seamless healthcare experience, both for our providers and for our patients, so that we're improving that healthcare experience overall, not just from the satisfaction level, but also the efficiency, the cost, and the overall quality of the outcomes. One of the powerful things that chief medical officers can do is really form that relationship through translation. And we often look at ourselves, and I look at myself definitely as a translationist. How do I help that level of understanding that maybe a business person is looking at it clearly from a financial perspective, or they're looking at it from an operation perspective, or the technology side is looking at it from the technical aspect. But how do we put that together into a comprehensive understanding that everybody's understanding the impact that it has on healthcare and hears it in some of their own language? And that's part of the skill that I've been able to develop over these years, is really how to take the other's perspective and use the empathy that I've learned as a physician and apply that into the language and how we relate to each other and get it into each other's context. What I really look for with these tools and resources is how do they harmonize all that information and put it into a seamless package? Because that's what we're looking for. How can I, as a patient in my most crucial moment of life, be best supported by services and staff and clinicians to get me from whatever happened to health again, or whatever that next part of my journey is going to be? And if that can be done seamlessly, integrated, and holistically, it's going to be better for everybody. Now, on the data side, we got to take that same language and rotate that back to say, how do you get there from a platform? Well, you have to have that interoperability in place. You have to be consuming data from multiple different resources that puts that together in a comprehensive package. And as you mentioned earlier, many of these things, these packages of care management and other services come from home healthcare companies, hospice companies, the health plan, the provider, the specialty provider. And if each one of those is operating in isolation and in silence from each other, then you end up with that fragmented process that I described earlier. So how we take that information, not only ingest it through interoperability, but then put it into a seamless pathway that there's clear understanding about what's happening to that individual at any moment in time.